Congratulations on the birth of your new baby. Now that it's time to bring baby home, we here at Renown Children's Hospital want to provide you with some basic information on how to take care of yourself and your baby at home. It is absolutely normal to be experiencing extreme tiredness after the birth of your baby. Try to sleep while the baby is sleeping, and ask for help with cooking and running errands. If you had an episiotomy during delivery, you'll be a bit sore for a while. Be sure to use your peri bottle to keep the area clean until all your bleeding stops. If you had a C-section, try to keep the wound clean and dry, and you shouldn't lift anything heavier than your baby for the next 6 weeks. You also want to avoid putting anything in the vagina for 6 weeks. That means no tampons, douching, or sexual intercourse. Your bleeding might last 2 to 4 weeks, and that is perfectly normal. Don't worry if you need to go to the bathroom a lot after delivery. Urinary frequency is very normal. Be sure to drink 6 to 8 glasses of water a day, eat extra fiber, or use a stool softener if you feel constipated, and try to eat nutritious, balanced meals. One more thing to note, you can get pregnant again even if you are breastfeeding. Talk to your doctor about birth control options. Your newborn will have his umbilical cord still attached for about 8 to 10 days. Until that cord falls off, give your baby gentle sponge baths using warm water and a soft washcloth. Once the cord is off, you can switch to the sink or an infant bathtub. Be sure to have all your supplies close at hand and never leave your baby alone in the tub. Try to find a quiet time to gently file your baby's fingernails so he doesn't scratch himself. Use an emery board, don't try to clip or bite his nails. Over the next couple of years, you will change thousands of diapers. Infants generally have 6 to 8 wet diapers a day and 2 to 4 loose bowel movements a day. That's a lot of diapers to change. While your newborn still has the umbilical cord attached, be sure to fold the diaper below the cord. For baby girls, always wipe front to back. A little pink discharge is perfectly normal. For uncircumcised baby boys, do not pull the foreskin down to clean. A simple wipe will do. And don't forget to wash your hands after changing baby's diaper. In fact, anyone who handles your newborn should wash their hands before holding or feeding the baby. A quick note on dressing your baby, always put one more layer of clothing on than what you're wearing. Use a hat to shade out the sun and never put clothing on your baby that has drawstrings or ties. Get rid of that old idea of 3 meals a day. With a newborn baby in the house, mealtime happens around the clock. Most newborns need to eat 8 to 12 times a day. You might even need to wake your baby to feed. If you're breastfeeding, offer both breasts every 1 to 3 hours, or if your baby is showing signs of wanting to nurse. The rooting reflex is a sure sign that your baby is hungry. If you gently touch your baby's cheek and he turns his head toward your touch, that's a sign that he is rooting or wanting to nurse. Getting breastfeeding going with a newborn can be very tough, but there are many resources to help you. The Lactation Connection offers private consultations with board-certified lactation consultants. To schedule an appointment, call 775-982-5210 or visit renown.org/thelactationconnection. The Lactation Connection also offers classes and forums to support you and your breastfeeding journey. The average newborn sleeps most of the day and night, only waking up for feedings every couple of hours. That means your new baby will be spending a lot of time in her crib or bassinet. Make sure the crib your baby is sleeping in is safety approved and has a firm and tight-fitting mattress. Always put your baby to sleep on her back. Using wedges or pillows is never recommended. And be sure to leave all those adorable stuffed animals and blankets out of the crib. Many parents worry about bald spots or flat heads from putting their babies to sleep on their back. When your baby is awake during the day, try a few minutes of tummy time. Put your baby on her tummy and place a few brightly colored toys just out of reach to keep her occupied. Be sure to keep a close eye on your baby while she is on her stomach. Researchers believe that placing a baby to sleep on her stomach increases the risk of SIDS, or sudden infant death syndrome. The safest way for your baby to sleep is on her back. Did you know that 1 in 10 women can experience the symptoms of postpartum depression? Postpartum depression is a more severe version of postpartum blues, or the baby blues, which are caused by a sudden drop in hormones after you give birth. New moms with postpartum blues often feel weepy, irritable, and impatient after giving birth. These feelings are normal and should go away within a couple of weeks. But if you experience more intense symptoms of hopelessness, loss of control, fear of holding your baby, sleeplessness, excessive or constant crying, loss of appetite, and lack of interest in your personal appearance, it's time to be concerned about postpartum depression. These symptoms can start a few days after giving birth or weeks or months later. If you are experiencing any of these more serious symptoms, call your OB right away. Your doctor can help make you feel better. Taking your new baby home from the hospital can be one of the most joyous and nerve-wracking events of your life. Figuring out how to properly install the car seat and getting your newborn baby strapped into this crazy contraption can be very intimidating. If you haven't done it already, we recommend you have your car seat professionally installed. The car seat safety station is staffed by nationally certified child passenger safety technicians. They will make sure your car seat is installed properly and teach you how to use it the correct way. In the state of Nevada, the #1 cause of death for children under the age of 14 is motor vehicle crashes. The misuse and non-use of car seats is a big contributor to that statistic. You can find more information about car seat installation at renown.org/carseat. Immunizations have been controversial in recent years, mostly due to misinformation. Here are some facts to help clear up those vaccination myths. Vaccines are very safe. Multiple studies have shown there is absolutely no link between vaccines and autism. Vaccines save lives. Your baby is at greater risk for getting seriously ill, suffering pain, a disability, and possibly even death if he is not vaccinated. Millions of children are safely vaccinated each year. The most common side effect is mild pain or swelling at the injection site, which can be easily managed with over-the-counter pain medication. It is very important to bring your new baby to the pediatrician for regular well baby visits and immunizations. In the first year of life, your baby will receive multiple doses of vaccinations, but these vaccines will protect your baby's health for years to come. There's nothing more frightening for a new parent than when your baby is sick. When should you call the pediatrician? Here are a few tips and general rules of thumb. If your baby has excessive diarrhea, has been projectile vomiting for 24 or more hours, has an unusual rash that lasts more than 24 hours, is very sleepy and hard to wake, has bright yellow or pumpkin-colored skin, has a temperature below 97.6 or above 99 degrees, isn't feeling well, isn't breathing well, or is crying uncontrollably with no apparent reason. If your baby is experiencing any of these symptoms, it's time to call the pediatrician. And what about mom? You've just given birth to a beautiful new baby. You're definitely feeling tired, probably feeling a bit sore and uncomfortable too. But if you develop a fever above 100.4 degrees, heavy bleeding, a foul odor from the vagina, urinary pain or burning, pain, redness, and oozing from your episiotomy or C-section site, or severe depression lasting more than 24 hours, it's time to call your OB. By the way, taking a baby's temperature isn't as bad as you think. You can do it under the arm. Just make sure the underarm is dry, and be sure to place the thermometer up and toward the back of the armpit. You only need to take your baby's temperature if your baby is hot or cold, or you think they may be sick. All of us here at Renown Children's Hospital would like to congratulate you on the birth of your new baby. We wish you health, happiness, and lots of giggles and smiles to come. Thank you for choosing Renown for the birth of your baby. More information about newborn care can be found on our website, renown.org/children.